Hey, good afternoon, everyone. Welcome to another edition of Healthcare Unmasked presented by UTMB Health. And this month being February, that means Heart Health Awareness Month. And that's our subject matter here today. It's a heart-to-heart discussion that we'll be having today about heart health and your health as well, along with that, particularly focused on those issues among women. And we're great pleasure to have on with us today Dr. Gal Levy, got to make sure I do that right, Dr. Levy, who is a surgeon at UTMB and a groundbreaking surgeon at that. We'll point that out in a little bit. And then Amy Doherty, who is celebrating pretty soon her third year since her open heart surgery. And we hope her story will motivate a lot of people to go get checked up, no matter how you feel, and don't find yourself just looking back and saying, oh, that's just something else. And you'll hear more about that as we go along. And as a reminder, too, we will be also promoting the fact that you can go to the Go Red luncheon happening in League City. In fact, Amy, you're a big part of that. That's coming up Friday at South Shore Harbor in League City. Still some tickets available, and we have the link where you can find out about that on our site in the comment section. You can go in and take a look at that as well. You can submit your questions as well as we go throughout this on heart health. I'd be more than glad to take those questions from you throughout the day here. So I appreciate y'all both being on with us here today. But Dr. Levy, let me just start with you. I should note she's got this great red, you said it's your signature scarf, right, that you have on?
That's correct. I've had a red scarf for about the last 12 years since I discovered the American Heart Association and began my interest in heart health in general.
And talk about, one of the things that we talked about in our pre-interview, getting ready for the show today, was that there's kind of this wide umbrella of cardiovascular or cardio that you specialize in. Talk about that in general sense of, because there's not just one thing within when you're dealing with the heart and cardiovascular diseases, correct?
When people think about heart disease and cardiovascular disease, they think about heart attacks. That's the big thing that people worry about. But heart disease is an umbrella term. It includes all things from heart failure, the coronary artery disease that leads to heart attacks, arrhythmias, abnormal rhythms in the heart, valve problems, genetic aortic problems. So heart disease in and of itself is a big umbrella term, and it encompasses a lot of things.
And one of the things that I always find interesting with folks' understanding is that you brought up, and it's something that should be stressed now, particularly as we're talking about in February and we deal with our luncheon coming up Friday, is that really heart disease is not talked about enough, particularly among women. And there folks will focus a lot when October comes around about breast cancer screenings and pap smears and the like, but really the real threat to women when it comes to health issues is heart disease, is it not?
Yeah, what a lot of people don't realize is that 1 in 31 American women will die of breast cancer each year, whereas 1 in 3 will die of heart disease. So it's very prevalent. The awareness that heart disease or cardiovascular disease also includes stroke events from a cardiovascular cause, and these events can claim the life of a woman about one woman every 80 to 100 seconds. And what also people don't know is that 80% of these cardiovascular events are preventable.
When we say preventable, we know we get the normal, okay, eat healthy, work out, and everything else about that. But what are some other steps that folks need to be doing to make sure they're preventing heart disease down the line?
Yeah, just like, it's an umbrella term for cardiovascular diseases. There's a lot of things we can contribute to prevention. And you're right, healthy choices are important. Smoking is a risk factor for heart disease. Hyperglycemia, diabetes is a risk factor. Manage your blood sugars. You want to control your blood pressure because high blood pressure can lead to heart disease. Cholesterol, which is familial as well as, what we eat every day. Family history is really important too. So if you have a family history of members of your family having heart disease, whether it's valve disease or atherosclerosis or aorta problems, you want to get checked out early. And we tell everyone to stay active and manage your weight and eat healthy. But most importantly, preventative medicine and preventative care has to start with your visit, your wellness visit to your primary care doctor.
One of the things that we need to probably talk about here is that particularly when it comes to women, I should say, when it comes to heart disease, is that the symptoms with women are misunderstood or misidentified in many cases. And I wonder if you can talk about that because, the stuff you told me yesterday was fascinating. I wanted our viewers to hear that now as well.
Absolutely. We think, when people are saying, "Oh, I think I'm having a heart attack," the typical symptoms we think of is chest pain, crushing chest pain to the left neck, radiating pain down the left arm. And these are all true, but all of these symptoms were in studies that looked at a very specific demographic, and that's Caucasian males. Caucasian males that were age 60 or older. And what we're learning over time since then is that women experience the symptoms differently than men. So they can experience nausea or vomiting. They may experience jaw or neck pain. They can experience something that they think is reflux, GERD. If they had a history of GERD and they have maybe a hiatal hernia and they know it, they're like, "Oh, this is just my GERD." And they tend to downplay their symptoms a lot. So by the time women actually have a cardiovascular event, it's its third or fourth episode that went unrecognized before it's noticed in a hospital setting. They can have fainting events and just general fatigue or shortness of breath, which is going to be, their symptom for a cardiovascular event or or even their disease process.
Also, too, that this was something that just fascinated me is that we have classes all the time on CPR of how to revive someone if they have an issue. And you were telling us yesterday that women, when they are having an issue, bystanders are less, even if they're trained, are less likely to provide CPR to a woman than they would if there was a man.
Yeah, and that's mind blowing because if a woman has some sort of event where, she's fainting or is in distress, bystanders are less likely to come to their aid or care because they're afraid of being accused of inappropriate touching, sexual assault, injuring the victim, and unfortunately it's also demographic related. So African American women are less likely to receive bystander CPR as well. So it's pretty chilling when you think about it.
In a little while, we're going to get some more details on how, at least what we're seeing is a trend change. I hope I'm saying right when we say trend of how more and more awareness to differences among not only with gender but on race and the like, and more studies are being done to understand the different symptoms and the like. And we'll be doing that here in a little bit. Plus, hearing from Amy Doherty. Let's pause right now though and take this quick message from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
And back here again for another edition of Healthcare Unmasked, presented by UTMB Health. And joining us is Dr. Gal Levy from UTMB. And Dr. Levy, this is Heart Disease Awareness Month, and you've put together a little presentation for us to kind of walk us through to give people a better understanding of what we're talking about here. And it's something that shouldn't be only talked about in February of every year, too. It should be something talked about year round. So I wonder if you can just walk us through that right now.
Absolutely. And we talked a little bit about this, to the start of our conversation. Heart disease is something that we should talk about every day, all the time. And heart disease and awareness in women is something that's coming more and more to the forefront because there's more and more interest and realization that heart disease is the #1 killer of American women across the United States. It claims more deaths than breast cancer or any other cancer, smoking related diseases or otherwise. And 80%, like I said before, 80% of cardiovascular diseases can be prevented. In February, just about a year ago, there was an article published in the journal Circulation, which is one of the leading journals talking about heart disease, and they did an online survey of women, right, over the years, ages of 25, and over the course of 10 years. And what they saw was pretty striking, that the awareness of heart disease in women by women has declined from 65% to 44% in between 2009 and 2019. Women who were older and had more of an education background were more aware because they were involved and educated, but awareness was lower amongst the non-white women or women with high blood pressure, not realizing that high blood pressure or hypertension can contribute to their cardiovascular diseases. And the greatest decline, so not just, they were aware in 2009, but that demographic that declined in awareness was among Hispanic women, non-Hispanic Black women, and the 25 to 30-year-old age demographic, which is really interesting because that is the demographic that over time will become susceptible to heart disease.
How do we tackle that problem? How do we say, all right, I know things like this will help. We're going to hear in a little bit from Amy about events such as the Go Red luncheon that will be taking place Friday. But how do we get this message out? I mean, there's been an effective campaign, for example, October, about breast cancer screening, getting your mammograms out there. That works and is successful. Now, during COVID, we've seen up to 80% of screenings in cancer. I know the drop by 80% in there, and I'm sure we've seen this on the other side. But how do we get the message out, particularly among women, who this is the number one killer for them is heart disease? How do we get that message out and change these numbers that we're seeing?
That's an excellent question. And I think awareness is where everything starts. We start from our medical community, we start by educating our medical colleagues. We start by bringing awareness to primary care and family practice medicine. The people who are seeing the patients first, they're our front line for wellness and health visits. And teaching people and making them aware that women will complain of symptoms, and we should be listening more carefully to when women come in saying, something's wrong. My body is changing. I don't feel well. I'm more tired than usual. The symptoms get dismissed often enough as hysteria or anxiety, but unfortunately, even, for women, this is real. They're symptoms that they're complaining of. It's not all in their head. It's usually something physical that's preventing them from living the quality of life that they had before. So it starts with education, it starts with awareness, and it starts with these, campaigns for Go Red for Women and bringing awareness to the community.
And you can see some of the tips there. We'll make this available online for folks to download as well. This is an outstanding presentation. Thank you again for that, Dr. Levy, along the way. And the other part of this is data is always, I think, the way to really point this out. And we talked about the CPR side of things, but the part of getting more data and understanding this better is clinical trials. Those are the heart, if you would, of understanding this better, and that only 38% of participants in these cardiovascular trials are actually women.
This is true. So when we look at all the data that we collect over time, the majority of participants were men. And of those men, the newer trials are a little more evenly distributed, but the original trials were predominantly Caucasian men, mostly through the VA. Now that awareness overall in general, gender disparity, racial disparity has become more prominent, and we're talking about it more. Studies are now focusing on creating a demographic that's applicable to the span of the patient population across the United States, not a single focal group. And through that, we're learning that, there is a gender disparity, not only in the women that are recruited for trials, but also women with symptoms. I mentioned previously, menopause is a period of time where women's metabolism changes and they become more susceptible to, perhaps they had pre-existing atherosclerosis. At the time of menopause, they're going to start seeing these changes or feeling these changes, because that's the period in their life where cardiovascular risk factors can accelerate. And so we need to create studies that are looking for that patient population of women.
Particularly one of the areas, and you noted here in this slide, is hypertension or high blood pressure. That alone, if tackled, could help half of those who die as a result, and more than half, particularly among Black women that have hypertension. If that was dealt with alone, could prevent a lot of the deaths.
Yeah, preventative medicine is incredibly important, and high blood pressure is something that we can manage with medication and watching patients and having them come up for regular checkups. Hypertension can lead to heart changes, it can lead to atherosclerosis, it can lead to stroke. So there are a lot of things where high blood pressure is very detrimental to the rest of our body. And if we're going to educate patients and allow patients to come in for their wellness visits, this is something that we can take care of before it ever becomes a problem for the rest of the body.
And then as you see the stats there too, and again, to reiterate this, 90% of the women who have one or more risk factors for developing heart disease. I just, if we said that in about any other disease, I think there'd be this bigger movement afoot. And as I said, I don't know how we change that other than putting the word out there. And the data just says that more women have died from heart disease each and every year since the mid 80s, when this was really started being tracked more as a better part of it, than men have. Yet, when we talk about heart disease, it's almost always everything you talk about with, go see your cardiologist or anything like that. We're always talking about men. The commercials for heart medicine are almost always men in there. I'm just now starting to see in the last few years that women are featured in those. And this is something that that we're going to be hearing from Amy here a little bit about how that message got through to her as well. And this chart, it's a little bit smaller here, but heart attack symptoms, men versus women. But you can tell, but just a quick glance, you can see certain items on that left-hand side by the man. There are the symptoms. Go to the right side. That's a much longer list there for women when it comes in. And a lot of people are just not aware of that. And we're going to make this entire presentation so you can download it and have it available for yourself to read through as an educational purpose on that to go through. And then talk about those warning signs. And of course, you see the website there that are for women about those warning signs, Dr. Levy.
Yeah, unfortunately, it's very unfortunate that the symptoms of heart disease in women are just misunderstood and not recognized or attributed to other things. And in addition, women in general will tend to underplay or give excuses. And so some of these symptoms from the Women's Health website on the VA talk about, if you have a funny rhythm or palpitations, that's a warning sign. If you're feeling pressure or squeezing, we can't always attribute that to anxiety. That might be an impending heart attack. If you suddenly have cold sweat or chills, that's a symptom. If you've been previously active and all of a sudden you're getting just fatigued with your regular day-to-day work, that could be heart disease. A shortness of breath and and fatigue work closely together. You're having trouble breathing, you're just going to take a rest. I'm just getting tired. I'm just getting older. We find excuses for everything. Dizziness and fainting could be a sign of a heart attack. It could be a sign of severe valve disease. And if you're having pain in your typical jaw, arm, hand, shoulder, or back, it might not always be reflux. It might not be indigestion. It might be a warning sign. And then just nausea and vomiting, which again could be from simple, I ate something bad. But if it persists and if it's in conjunction with any one of these other symptoms, you should be a little more aware that this might be a reason to go visit your local emergency room.
And that's the big thing. Be self-aware and then make and make those decisions. And this goes into what you were talking about preventative measures, but also that would mean understanding your risk factors there. And you
Yeah.
mentioned smoking and diabetes, obesity, the things we talk about. But there's other factors that are emerging now that folks may not recognize as a risk.
That are specific for women. Preterm delivery, gestational diabetes, preeclampsia are all conditions that can contribute to heart disease in women later in life. If you have an autoimmune disease, or if you've had a history of breast cancer treatment and radiation to your chest, whether it's from Hodgkin's lymphoma or breast cancer, if you had radiation to your chest, you're at risk of developing valvular disease later on in life. Um, the other, traditional, non-traditional risk factors are depression, which may be a sign of just a physical manifestation of something else that's wrong with your body. And that's in addition to our usual diabetes, smoking, and physical inactivity, high blood pressure, and high cholesterol. There's a lot of things we can manage with medication and awareness, but even people who are physically fit can fall, into this category of having a heart disease, the potential for developing heart disease. But what we know is that people who are physically active for at least 20 minutes a day have less of a risk than those who have no activity for developing cardiovascular disease.
And then is understanding what is heart disease. We kind of started that off at the beginning as well. But if you can break that down for us.
It's great because heart disease is such a big term, and we don't think about, when you think heart disease, you immediately think of, well, am I having a heart attack? But arrhythmias due to valve disease, mitral valve, your mitral valve or your aortic valve might not be working as they should and can lead to a funny rhythm. Sometimes if you have bad atherosclerosis or coronary disease, you might develop a funny rhythm, and that's another indication to get it checked out and make sure that it's not because your heart is suffering from, good blood flow to the little vessels. Uh, the other part of this is heart failure. So preeclampsia and pregnancy can predispose some women to developing pregnancy-induced cardiomyopathy or heart failure. And this is a serious problem that may lead women down a pathway that they might need a transplant down the line. But we want you to be involved with your cardiologist if there's any chance that you've ever had heart surgery in the past, or you've had a family history of heart or valve disease. We want you to be aware and know that, pregnancy, it can contribute to some of these risk factors and lead to heart disease down the line.
And then there are choices, the preventative choices they can make. Obviously, don't smoke. That's the one always at the top of the list there, that we hear over and over again. But stuff like I know of eating healthy, but manage your blood sugars. That's toward your diabetes and the like. Talk about those things that folks can just do in their everyday life. You don't have to go super drastic, but take this part.
Well, this is the trifecta that we see pretty often. People who smoke have diabetes and have high blood pressure. That combination often leads to atherosclerosis or heart attacks and coronary artery disease that need either a bypass or a stent. Cholesterol is very much a big factor in these. So even if your cholesterol was normal or close to normal, after you have a heart surgery or a stent placement, we do put everyone on aspirin, on a blood pressure lowering medication, and a statin or cholesterol medication, because we can't make the disease go away, but we can at least try and stop it in its tracks and help prevent it from getting worse. If you have a family history, that's another one that can contribute a lot to your risks of developing heart disease. And people that come in that have had a family history with all these things, we're more suspicious and we're more likely to get their surgery done sooner rather than just medically optimizing them for a period of time. And the usual ones are stay active, manage your weight, and eat healthy. But smoking, it's not just for lung cancer. Smoking and diabetes and high blood pressure individually contribute to atherosclerosis of the little heart vessels. And when you put all three of them together, it just ramps up your risks for something to go wrong.
And then there are the guidelines, particularly one to be taken a look at.
The guidelines that came out last March, I think, are really fantastic. And this is just a snippet, just one small part of it, talking about how now we're realizing that pregnancy outcomes like gestational hypertension, gestational diabetes, small for gestational age delivery, pregnancy loss, placental abruptions, they're red flags for cardiovascular disease later in life. So if you've ever had them in the past, you want to be in a strong relationship with your primary care doctor and a cardiologist, looking out for these diseases before they cause a catastrophic event. Black, Asian, and Hispanic women are more likely than white women to experience these pregnancy outcomes. And this boils down to the availability of healthcare and preventative medicine in socioeconomic classes. And so we are putting in effort and, research money into understand and addressing these disparities for preventative care. And our health system, it needs to recognize that women who have these pregnancy complications, we have to vigorously invest and take care of them to prevent that cardiovascular disease down the line.
Is when we talk, a lot of what you heard here, that Dr. Levy has spoken about, is something that's near and dear to the heart of, and when I say to the heart, I think it's appropriate, Amy Doherty. A lot of us know her in the area for the great food she caters up through Robotic Caterers, but she's also a survivor in many ways, and had open heart surgery. Coming on your third anniversary now of your open heart surgery, right, Amy?
Well, yes, it will be May 1st.
May 1st, the 30th anniversary. But how you got from there to here now, being a survivor 3 years later, is a tough road. And I think goes to a lot of what Dr. Levy spoke about how perception, or how we perceive women versus men on this. And I don't want to make this a whole gender fight, but this is focused because it did make a difference of you. And you're an example of someone who, when the information was presented in front of you, finally just said, all right, I'm taking charge now. I got to do something. Why don't you share your story with us, Amy?
Well, like I said, will be at almost 3 years of open heart surgery. But prior to that, to my surgery, probably about 8 months before that, I started experiencing some chest pain, in the middle of my chest. And it was nothing, it would kind of come and go, just not feeling good, tired, that kind of stuff. I am a caterer. So I'm very busy every day, on the go, running, doing all my stuff. I also, at the time, was doing indoor cycle twice a day. So cycling about, 26, 27 miles a day. And so I went to my doctor and, said, I'm having these pains. And he said, you're healthy, you look great. You're buying a new house. Maybe it's just stress. And maybe it's from cycling, from pushing on your handlebars. So I carried on and did what I kept doing, and it kept getting worse. And so I was going to go to dinner one night with my daughter, and didn't feel good. Took my blood pressure, and it was skyrocketing. It was 204 over 198, and my daughter took me to the hospital. I spent 3 days there, where they ran a bunch of tests, and everything looked normal. Everything looked fine. So they sent me home and said everything looked good. So I kept moving along and doing my thing. And I went back to see my doctor a couple times. And again, he said he thought it was just, I could work through it, that it was just muscular from cycling. So that February rolled around. I was invited to go to the American Heart Association Go Red for Women luncheon. And I was there with my friends having a great time. And the speaker that was speaking that day started talking about her symptoms. She had had 3 heart attacks, and the symptoms that she had, the way that she tried to cope with some of her symptoms before she had heart attacks were exactly what I was going through. So it scared the daylights out of me. When I left there, I guess kind of went into a panic mode. Long story short, I ended up at the ER that night with chest pains and lightheadedness, dizziness, shoulder pains. And I was sent home that night again, just told that it was anxiety and that I maybe need to take a Benadryl and go home and relax. So I kept on, and the symptoms kept getting worse. To where I felt like I was in a faint and things like this. So I got my paperwork from the hospital and picked out a cardiologist and went to go see him. And he wanted to run a couple of tests on me and just to see how everything was. And I failed those tests and ended up with open heart surgery. So I had bypass surgery May the 1st of that year. So
And it goes to we've talked about this several times. Dr. Levy talked about this a little while ago. And by the way, we are showing there are some tickets available to the Go Red Luncheon, which in many ways, as I said, Amy, you don't go to that luncheon that day and hear that information and recognize the symptoms. I think we can say that luncheon helped save a life here. In many ways, you said you went to the hospital right away, but it goes into there were a lot of opportunities along the line there and we don't want to fault any doctors or any medical facilities or anything like that. This just happens because it's systemic, is it not, Dr. Levy? Is that it comes in, there are just kind of based on what I hate to say traditions, but just how things are, the stereotype of just kind of dismissing things along the way that would have been a red flag. As if I walk in, I'm a big guy, I'm a guy, I have my health issues, obesity and the like. I do smoke cigars. They're going to ask me that question. I tell them all that. And I walk in, have the same symptoms as Amy. Guess what? I'm headed to the ER right away, and they're not letting me out. I just talk about that difference of we already know why it's happening, but just of that difference that there are those missed opportunities, and that's why we were excited about doing the show today, because we're hoping folks recognize this, that the patient needs to take charge at some point and say, no, I want more testing done.
So you're right. I agree with you. I don't blame any of Amy's doctors along the way. They did what they thought was right with the information that they had. And this brings us back to awareness. We have to bring awareness to those primary care doctors that maybe these symptoms that up until now we've been taught are just anxiety and fatigue and you're working hard and it's okay. Maybe there's something deeper. And this is where education and changing our, medical understanding of how this disease plays in women is going to help better our care for our women population. And it, was an eye-opening experience for Amy to be part of that AHA luncheon, which is what it's there for. That's what it's designed for. Let's bring awareness to the community. And Amy did take a very proactive approach and said, I think I have this problem. Let's find someone who can help me. And she did the right thing. She found a cardiologist who probably said, I'm sure everything will be fine, but let's make sure. And that's why we do this. We want to make sure. We want to make sure that there isn't something there. I've done this for my own patients, getting them tested for non-cardiac surgery. And I say, let's just make sure. And unfortunately, it happens. In fact, we just had surgery not too long ago about a wonderful woman who came in with a completely different disease process. And I said, let's just get a stress test to make sure. It was abnormal. And all this time she thought she was having reflux. And she had the typical symptoms for reflux. Turns out it wasn't reflux.
Yeah. And what we say is typical nowadays. We're seeing more and more of things happen. And it becomes, the atypical becomes more typical now. Is that, I think we're seeing, you noted that in some of the things that we not before. Amy, what, for you, part of it is, we should point out, like you said, you were cycling, you were in those intense rush cycle deals. It wasn't like you met any of the, what we call the typical criteria of being a possible source of some type of heart disease that required surgery. along the line. You were living the life the way you were. You were busy. Yes, stressful. We know that in the work. But as you look back on what you know now to what you didn't know then, is there something you would have seen along the lines that you think you would have changed on any of this?
Um,
And just on your health, I should say.
Probably, yeah, on my health, no, I just, I knew it was so bad that I couldn't even sleep. I was getting up 3 and 4 times a night, and, I just kept wanting to sleep because, and now I know my, doctor's like, sleep is the best thing you can get. Rest is if you're tired, sleep, get some rest. That was the only thing that disturbed me, but now I know that my body was setting itself up for something not really good. So, but yeah, you know, it's hard to eliminate stress. But I try to stop and smell the roses and try to settle myself down a little bit more and take a nap when I need to.
Yeah. Also, too, is that you have now, and this is very admirable. You've taken kind of a charge of being one of those who is out there trying to get the word out of things. Talk about your activities now, just trying to women, in your circle, and obviously with your job, you'll come across a lot of folks that, yeah, you can talk to them as well as again, just if you don't know Amy, you should, by the way. Robinette Caterers, one of the best anywhere. I can tell you that much personally. They see me hang out at their booth at every Epicurean event they ever do. But you've making sure that the word's getting spread now, just to your own kind of own personal advocacy.
I am. I had my surgery, and shortly after that, I was asked by American Heart Association to be their speaker. So less than a year out from my surgery, I was the speaker for Go Red, and then the pandemic hit. But yes, I have a great networking group of women and men. But I've had several of my friends say, "Hey, I've had the same thing," or "What do you think about this?" or "I've been short of breath." And I'm like, don't put it aside. There's no joking aside. What's it going to hurt? Go get a checkup, go have it looked at. So I do get a lot of people that message me or call me and ask me symptoms. I am no doctor, but I know what I went through. And I have some friends that have had heart attacks or heart surgery. And I kind of touched on that yesterday, is actually having some friends around or support system for what happens when we're all through with this, because is it going to happen again? So just kind of bringing that awareness to people. I stay very active with the American Heart Association, and I have my little Go Red team that we walk in October for the Heart Walk team, or actually it was November this year. But yeah, so I will do anything I can. I have to say it pretty much saved my life. It brought reality to me. Everyone can say, "Oh, you have anxiety," or settle down, or "You work too hard." But when it just hit me that day, and here I am, thank goodness.
And you talk about friends and network and support. We need to show this here
Yeah.
at the American Heart Association Go Red Walk that happened in November. And here's a group of your pals out there: Lori Kopic, Brittany, the whole gang out there. They were dressed up as the Queen of Hearts and
That's my heart
having
team.
some fun. And they were out there, and I remember them telling me that they were doing this for you that
Yes,
day.
you are.
You couldn't make it yourself, but they were out there doing this for you. How important is it, Dr. Levy, chime in on this as well? How important is it when, particularly with women, when they're going through this, to know there are others out there, not only as a support system as friends, but also support system to say, "Hey, this is what it's going to be like," or "Here's what you need to do," or "Hey, let's go get a salad," or something like that along the way.
I think women's experiences is very different, right? Women are used to being the caretakers in their family. That's the role that traditionally we've been set up with in this part of the world. And then all of a sudden, you're sick or you have an illness, you need support. And who are going to be the people around you to rally with you and help you through these really difficult times? Because it's physically difficult. All of a sudden, you don't have the same mobility you had. You have a big surgery. It takes time to recover from surgery. You can't do all those responsibilities that you had before the surgery. You have to let your body recover. And I see this in women over and over and over. And 2 weeks after surgery, like, I want to get back to work. No, you must rest. You must let your body recover. You must let other people help you and take care of you so that you can get back to being, the role that you were doing before in the context you want to be doing it in. So we need those people to share those experiences, to let us know that we're not alone. You're not the only one going through this. Women, they live in their little nuclear core, and we have a really terrible tendency of Pollyannaing everything. Everything is great. Everything is fine. And inside, we struggle because we're taught we have to be the strong one for everyone else.
Yep. I would say on my part on that is it is important to, have your friends around and to I guess back to my story was I did start to feel a little crazy. I felt like, I've always have felt strong. I have always felt like I was the caretaker, the boss at work, just and I felt like, gosh, am I weak? Am I not strong enough to get through this? I was anxiety really controlling my life. And it was getting to me. So just for the note, I'm not crazy. So
Right. Well, Dr. Levy, you used this term when we did our preview yesterday, preview interview, that gaslighting. It's what it comes down to.
yeah,
I mean,
it
the
is.
way everybody treats it, and they don't. I don't want to say anyone means it or to dismiss it, or they're just. It's just. It is a systemic thing that it becomes gaslighting. It makes it sound like you are crazy about here you are again, and those type of things. Or Amy, I guess you, in many ways, for you felt that kind of pressure, even though maybe someone didn't say something to you,
Yeah.
or like, hey, calm down. You just felt it.
Well, my biggest thing was, I think the term anxiety has always been thrown around so loosely.
Right.
And, "Oh, I'm anxious. Oh, my anxiety's bothering me." And I'm like, "Dang, all my girlfriends have anxiety," and not all of them, but a doctor tells you, "Oh, well, maybe it's anxiety." And I'm thinking, "Gosh, my girlfriends are going through like hell. Like, this is hard. I cannot believe we all have anxiety."
Yeah.
And it does. There's so many thoughts that go through your mind, and I'm not saying people don't have anxiety, but I did, and I guess Dr. Levy could say that my body was full of anxiety, getting ready to.
It's telling you something.
It was
Yeah.
not.
It's telling you, your body doesn't lie. We just ignore it. And we go to our doctors who say, oh, it's not a big deal. The term anxiety replaced the term hysteria, because hysteria is not a politically correct word anymore. Hysteria came from the Greek idea that the uterus wanders in a woman's body, and that's why they're crazy. It's wrong. It's incorrect. It's not medically appropriate anymore. So, we have to be careful and listen to when the women come in. And you're absolutely right, TJ. A white guy like you, overweight, who smokes cigars, the first thing they would do is get an EKG, get an echo. If anything looks abnormal, you're on that table getting your cardiac angiogram. Whereas the women that they present in a more extreme event. If they came in with, I'm short of breath, or I have a little exhaustion, we're getting better. Don't get me wrong, we're getting better. As awareness becomes more prevalent in the community, our doctors are becoming more aware of how to treat the patients that are coming in through their offices. So education is there. But I wish I could tell you that Amy's experience is unique and infrequent, but unfortunately it's not.
And I used my example when we all spoke yesterday in our pre-interview, is that I was in my own doctor's office, and it's the regular. I was not even there for the hypertension that I go through. I was there for something totally different, But the normal, they weigh me, you're overweight. Okay. Then I sit down, they do the blood pressure, and then they go and it's 200 over something,
Oh my
and
goodness.
right off the bat, right? And it goes into, oh my goodness, hang on. Well, I said, let me calm down. We'll get better. It didn't get much better. So there was no examination, nothing. Dr. Sue gets on the phone, I'm to the hospital. There was no questioning, but I tried to stop it. I said, let me just go home. Let me take some extra meds. No, it was, you're going to the emergency room.
Extra meds.
Meanwhile, Amy, you go your situation. I have this. Oh, I'll just go home and rest. I mean, the difference there. And listen, and again, you can't. I don't want to blame individual physicians or anything like that, because it becomes the situation we're in. No patient's going to be. There is no cookie cutter thing, and maybe that's part of it too. Is that we always put everyone in this kind of these little silos, do we not, Dr. Levy? That just say, okay, it has to be this to be this.
This
Because
is what
if
we're
it's not
taught.
this, it's anxiety.
Yeah, this is what we're taught. People that have heart attacks look like this.
Yeah.
And now that we're doing more research and more education, we're learning, no, they look like anyone. Hashtag I look like a survivor. Anyone can be a victim of heart disease, and we want to make all of those people survivors.
Yeah.
One of our viewers came in on here, Dr. Levy, you can maybe chime in on this. It says, take statins make me feel miserable. Are there alternatives? I've heard some emerging things that are better, that not better than, but may help with that. But it's still kind of a newer side of things with that.
There are newer drugs, and I recommend, if your statins make you feel miserable, talk to your cardiologist and your primary care doctor and see what you're eligible for. Miserable comes in different flavors and varieties, and sometimes it's as much as just changing one statin for another. Some people can't tolerate it because they have muscle aches and cramps. Some people can't tolerate it because they have kidney issues. So there are medical alternatives. They're newer, they're more expensive. It depends what kind of insurance coverage you have, unfortunately, but there are alternatives. So definitely talk to your doctor, tell them, make them aware, ask them, what else can I do for this?
The key thing, I think, too, is talking to your doctor, and that becomes the key thing over and over again. But Amy, for you, the anxiety or that comes with this, or the pressure didn't stop after your surgery. You were telling us that now even slight things come up and you get worried about them.
I do. The anxiety has shifted. So yeah, it's always in the back of my head. Is this going to go wrong? What if that goes wrong? You wake up in the middle of the night and it just kind of brings back 3 years ago when I would wake up in the middle of the night with chest pains. So that's always there. I have a great support system that does help with that. I have my family and friends close by if I need to make a phone call to kind of comfort me. And, I'm just always on alert. I have a very good friend of mine that had a heart attack a year after I did, and she's the same way. So, it's always just something to keep a closeful eye on.
And Dr. Levy, you were saying that really there are some of these post-surgery, I guess symptoms would be a better term, or feelings or the like that come up that are actually common and to be expected. What are those, and so that folks can understand?
Yeah, the heart surgery, no matter which flavor you make it, whether it was on a bypass machine or a beating heart surgery, these are all big surgeries. And it is normal, absolutely normal. We tell our patients it is normal to not be able to sleep well. It is normal to not have an appetite after surgery. It is normal to have a metallic taste in your mouth and feel like food doesn't taste good, and that's why I don't want to eat. But nutrition is so important after surgery. We will throw in short at you just to get protein in your body and let your body heal. As your body starts to heal, things do get better. But over time, Amy's fears and anxieties are absolutely normal because she went through this process over and over and over and was told it's no big deal, it's no big deal, it's no big deal. What happens the next time? When is she going to be taken seriously? When is she going to come into her doctor's office, her primary doctor's office, and say, I'm getting more fatigued, I'm getting more short of breath, and get a different answer from, oh, it's normal because you work really hard? Maybe the answer should be, you're right. Let's get an echo and make sure your heart's still working well.
it goes into also, and Amy, I think you would agree with this, is that as patients, we need to be a little more aggressive, saying, no, I want, the old line of second opinion. And I still see this so many times nowadays with folks that just they'll ask 25 different questions about something that's on sale for 10% off at a store. But when they are told, hey, so we've done this exam, we found these things, maybe this, and any other questions? And they go, no, and just walk out. And they've got the foremost expert sitting right in front of them they can talk to about it and go further. Is that part of it? I mean, this is a two-way street. Yes, the physicians are trained. Yes, they need to be probing, but the patient also has, because that's part of the system, is you want to go with where the patient wants to take you as well. The patient needs to not feel like if I bring this up, the doctor is going to think I'm stupid or that I'm over checking this, that it's okay to ask questions. It's okay to press forward. Do you think I need to do this?
I would say for me, I feel like most people would know, like I knew something wasn't right. And sometimes I think facing reality and saying I don't want anything to be wrong. So if I go to the doctor, they're going to tell me something's wrong. But you may not have an opportunity to do that. So I knew something was wrong. And like I said, I just kept going. So then you do start second guessing yourself. But being persistent, my parents joke about that I've always been persistent, but this time it really paid off for me. So yeah, if you know, and I think women especially have that instinct of knowing something, but kind of like Dr. Levy said, that reality and knowing, you've got to wash the clothes, you got to take the kids to school, so just getting that all, it's not in my schedule, it's not in my planner, so I'm not going to do that right now.
But that's also go to the point that folks will account for that and say, oh, you're just a mom, you're supposed to be stressed.
Yeah.
Right. I mean, that comes across too.
Yeah, so I guess, my thing to everyone, and I had told y'all, my kind of tagline is don't ever think it can't be you, because it was me. It started, when I was 49, I had surgery when I was 49 years old, healthy, working out. I don't smoke, and just to think, I know, a very good friend of mine that happened at 48 years old. It does happen. So don't think I have to be 75 years old and overweight and diabetic, because it happens more often than I think that we really think, for us women that tend to ignore that. So just don't disregard it.
And I want to piggyback on what Amy and TJ were talking about. We, as physicians, we love it when you come in with questions. Come in with the list of questions. It's going to make that interview, we're limited in the amount of time that we can sit and talk, and it's going to make that clinical visit and that interview so effective and so productive. When patients come in and I walk in, introduce myself, get a history, they say, we have questions, let's review them. It's wonderful. You put time into thinking about what you're worried about, and we make sure that we address them at that visit, rather than coming in, having a conversation, then you leave and nothing's been addressed. We want you to come in and we want you to come back if those questions weren't answered. We have Epic now. You can send questions through the system, through the hospital-based system. And TJ, you said something about a second opinion. I am a surgeon, and it is my job to offer people surgery. But I also tell them, if you don't like my answer, or you don't think it's the right answer for you, this is your body, your choices. My job is just to tell you risks and benefits of what I can offer. And two, you are welcome, and I support going to get a second opinion if you think someone else is going to give you an answer that you're more satisfied with. Having a relationship with your doctor, having a relationship with your surgeon is very intimate. My hands are physically in your body, holding your heart. You've trusted me with the most precious organ that you have. And it's my responsibility to make sure that I can do a good job, but it's a relationship that we have with the patient. And if you're not comfortable with your surgeon, or you're not comfortable with that surgeon visit, find someone you are comfortable with.
And with that, we do have a question. I popped it up earlier, but I wanted to get up. Kimberly Kyle asked a question earlier. She says, I have post quad bypass discomfort in my wires that put me back together. Throbs, another issue. I do not have stamina I had before. Is this typical? And I don't have from Kimberly when this surgery was done. But you had taught, Dr. Levy, and obviously you can't diagnose from afar here or anything like that. But can you talk about that there are issues after surgery? They're going to be there for a while. It's not just because you had the surgery doesn't mean it goes away.
Correct. I don't know when the surgery was or what the time frame is. It's normal to have discomfort in your chest. So here's the other thing that people don't know. When the chest comes apart, we have to put it back together. And sometimes those wires might be loose. Sometimes the chest might not be aligned. Sometimes the chest can fall apart, and that can cause a lot of discomfort. When I first started my practice here, there was a gentleman that came to me from Austin because they Googled me online to rebuild his chest wall because he had had surgery, and for 3 years, he couldn't breathe, he couldn't talk, he couldn't sleep because his chest wall had just fallen apart from the surgery. He had what is called an unstable sternum, and this is something that is rare but can happen after heart surgery. So you want to, we did a whole 3D reconstruction of his chest wall and rebuilt his chest wall and gave him a incredible quality of life. We gave him back his life. And so when we talk about post-heart surgery discomfort, talk to your surgeon, talk to your medical doctor, because if it's a short interval after your surgery, it usually gets better. If it's been a year after your surgery and it hasn't gotten better, go back to your surgeon or find another surgeon who will listen, because we do work this up. If you're still having pain from your wires, I will get a CAT scan. And I will see, are those wires in the right position? Do they need to come out? Are they sticking out of your skin? There are a lot of things that come into that. So, to the woman who posted that comment, your pain is real. Your discomfort is real.
And we should put out, Kimberly just texted back to us. It was 6 years ago.
Oh,
And
wow.
so if she's still experiencing that,
You're
then
still
based on your,
experiencing discomfort.
yeah,
Come
in.
come to us. We might not be able to solve the problem, but at least we'll put the work into trying to figure out why you're having that problem.
Right. And there's always, as you had said earlier, you welcome the questions, welcome that in, and that would be good. One of the topics I want to talk about, and we talked about this some in October about breast cancer surgery, but Dr. Levy, you're a big advocate because guys will wear their heart surgery scars like a badge of honor. Women are not the same way. You actually have an approach to less invasive or less scarring and starting below. Talk about that, because that's also important in this for women specifically.
For women specifically, I actually make my incision a little smaller, specifically for women. I start a little bit lower because women want to wear a V-neck, because women don't always want to wear a scarf when they're walking out and having dinner. And the reason I say this is because my mother had heart surgery in 2006, and I'm still hearing about her scar because she had men who operated on her and they did not make it look pretty. My patients, it's got to look pretty. And that's what everyone knows. As we finish surgery, we got to work hard and make it look pretty, because they are going to wear this scar. And it matters. It matters. The aesthetics matter, and the aesthetics matter more in women. We want symmetry in our chest wall. We don't want a zigzag scar. It's just not pretty. And aesthetics are important for women. We are judged on our looks all the time. So we make it an effort. Now with technology and robotic surgery, we can do big surgery through small incisions. And, again, if you want, not everyone is a candidate. I'll start with that. Not everyone is a candidate for small incision surgery.
Right.
Very few people are, but the ones that we can do it on them, we should do it on them. Right? Big surgery through tiny, tiny holes.
Yeah. And I just wonder, Amy, when you went in for your surgery, was that even part of the discussion? Or is it more of, let's go get you fixed?
No, not for a 3-vessel or 4-vessel.
Yeah, right.
No, that wasn't. I knew it was coming. And I have a scar. And at first, I sat in the hospital ordering every top I could off of Amazon that came up to here so that no one would see my scar. And now I'm like, I'm okay with it. And if someone asked me, what's going on or what happened, then I don't mind talking about it at all. So sometimes it comes up as a topic.
Yeah,
So
you can use it as an educational purpose as well at times.
I'm just grateful to be here, honestly. So
Yeah, that's great. Amy, thanks a lot for sharing your story with it.
sure.
As I said in our interview, I've heard the story a lot from your friends, particularly all the way around, and it's an amazing story. And Dr. Levy, thank you as well for bringing your expertise and answering our viewers' questions as too. As a reminder, you folks, as soon as we're done with this broadcast, it's available right away. So if you came in late, you're able to go in and replay this. And we encourage you to share this as well with your friends. So that they have more, particularly your friends that are women, so they have that. And a reminder too, the Go Red for Women luncheon is happening at 11 a.m. on Friday. Tickets are still available. We have the link there. We also have in the chat area as
I'll
well.
be here.
And Amy will be there.
There.
Dr. Levy will be there. I'll be there. My wife is going to be there as well. And a lot of folks from UTMB are going to be there as well. We do encourage you, while it's not required, we do encourage you to bring a mask. Bring a red mask. It looks good out there. And it's always by the way, it's an educational event, but it's actually a fun event too, by the way. I should point out that every year we've gone, have really enjoyed the event, not just for the information we get, but also from the event itself, of just having a good time and seeing folks. So that's one of the side notes to it, is it is a fun thing to go to. We do encourage you to go on out there, and we will also don't want to miss out is that some of the women that are going to be there you see on the poster here, that'll be a part of this. That they said now, Amy, are you on this poster?
I am not on that poster.
Okay.
I am not.
Okay, but we're going to make sure you get you up there one time. I know you were. We'll have you as the speaker one time, but that was during COVID, was it not?
It was right before
COVID. So that we had that. So,
so.
but coming out, and UTMB Health is one of the one of the big sponsors of that as well. So make sure you make your way out there as well. So thank you all for watching today. Dr. Levy, thank you so much. And Amy, thank you as well. And thanks to UTMB Health. Again, this will be available on replay as soon as we finish up. You've been watching Healthcare Unmasked, a heart-to-heart talk about heart health. That's a tongue twister if there ever was. Presented by UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.